Kia ora koutou. Thank you so much for joining us tonight. It's a pleasure to have you all here, and we're delighted with the turnout for this webinar. So thank you, and thank you for taking the time on a cold and blustery Thursday night in Wellington. So just for those who don't know why you're here, this is a webinar hosted by the Vet Council. I'm Ian, I'm Chief Executive of the Veterinary Council. This is one of our semi-annual wellbeing webinars, and this time around we've decided to shift the focus a bit. You know, we've done a few now on personal focuses on well-being, which is always very, very important and absolutely vital in the starting place. But we also recognise that a big part of your mental health and your well-being comes from your workplace, and certainly that's a focus for a lot of stressors. So we thought this would be a good opportunity to talk to folk about well-being in the workplace in ways that we can seize the opportunity there to make it work and to make a better workplace for all of us. So I might just hand over to Stephen quickly to introduce himself, and then we'll turn it over to Fiona and Ritska.
Tēnā koutou, ko Stephen Butler tōku ingoa. Welcome everyone. I'm a professional advisor for the Vet Council. I know a number of you, and if you don't know me, reach out. I'm here, can touch base with you all. Look, yeah, a great opportunity. I think Ian's touched on some of the webinars I've run in the past have been more internally focused. This one is, I think, a lot more, well, not more exciting, but equally as exciting, given if you're a leader in your team, this is going to give you great skills to apply some well-being sense to your business. If you're not the leader, it might give you some good skills on how to encourage that sort of good well-being in your environment. So look, it's with pleasure I introduce Dr. Ritska van der Brink and Dr. Fiona Moore from Connect Communications. You've probably seen them before if you've seen any of our webinars, but they're great. So I'll hand it over to this team. Thanks, guys. Over to you.
Kia ora, thanks, Susan. So good evening, everybody. Kia ora koutou katoa, ko Fiona Moore tako ingoa. I'm from Scotland, obviously, by my accent. Been here for 30 years. I've got a background in general practice and a PhD in clinician wellbeing, and I've been doing quite a lot of work with veterinary teams over the last 4 or 5 years. Ren's going to introduce what we're doing tonight, but I did want to say a couple of things. Firstly, I'd like to say thank you to Lottie Cantley, who has assisted with some of the content for this webinar. She is, of course, one of your veterinary experts in wellbeing. You're very lucky to have her in the country. And just for the format of this webinar, we know that you're out there and you can't see each other and it's all about us, but that's not how we want it to be. So please ask questions in the Q&A. Those are anonymous. If you ask in the Q&A or you want to make a point that's anonymous, put it in the Q&A, or as long as it's professional enough, even if it's anonymous. And you might want to put some things in the chat, but then we can see names on it. Okay, so that's the way that the questions can work for this evening. So just handing over to Ren here to get us started.
Kia ora koutou katoa. So ko Ritska van der Brink tōku ingoa. And I'm from the Netherlands. And also my background is in general practice. In fact, Fiona and I met in the hospital when we were junior doctors together. And
a long time ago.
Yes, a long time ago. And we've been working together ever since. So I'm a psychotherapist in my day job and helping with being one of the directors of Connect as well. So today the focus is on making the business case for well-being. So that means weighing up the sort of pros and cons, really, because it's not just a flaky sort of soft skill. What we know from the research now is that well-being actually impacts your bottom line, and that's what we're going to unpack a little bit more, so that hopefully you'll be able to get a bit of traction, especially when you engage with senior management about well-being and burnout prevention.
And we know that there's different people at the webinar. So some people may be here hoping to engage with senior management, or there may be some senior management here hoping to engage the employees in their practice. So it sort of works both ways, doesn't it? We all need to be able to have these conversations and to sort of engage with somebody who's a bit resistant. So yeah. Even the word well-being sets off, people's, sort of triggers, and they just hate it, some people. So what happens if you're passionate about well-being, but other people in your clinic aren't? So we want to try to think about some of that. So that's our focus for this evening. So we're not really getting into well-being strategies and stuff as such with this particular webinar. So we're going to start off thinking about what we call pain points.
Yeah.
So what's a pain point
So
then?
a pain point is a persistent or recurring problem with something that's happening at work, and it can often be a really good hook for looking for places to change. It can be, commonly used as a way of getting traction for initiatives. So we're going to share a few of them.
Yeah, so let's have a think about what sort of pain points you might be having, and we're going to actually ask you a bit about this. We'll do a poll in a second, but I just want to have a look at this on this PowerPoint. So if we just go here, going backwards here, so assuming you can all see my screen there, here's a common one. So holiday cover is a pretty common pain point. This, of course, isn't just with veterinary practices. So it might be school holidays, you don't have replacement staff, you've been already declining leave requests, and you can't even have leave yourself. So quite a common sort of pain point.
Another one might be team conflict, where you're regularly overhearing sort of upset discussions, people arguing. Some of your colleagues that might normally not be irritable or, difficult are more so. And you notice there are maybe tense atmosphere at work where there's sort of people not talking to each other, there's unresolved issues, and you might be feeling really powerless about that.
And it's thinking about how much do you want to get involved really is quite important here, isn't it? So often when we have conflict around us, we decide to ignore it because it feels too tricky, and we're a bit worried if we open that can of worms, we won't know when to stop, so often we just carry on in an uncomfortable atmosphere. So conflict's a very common pain point. Of course, we've got complaints from clients. So here's an example. You've got a long-term client who you have always had a good relationship with, but now they're getting frustrated because they feel the waiting list is unacceptably long. And one of the frustrations with this pain point is that it feels outside your control. You also would like the waiting list to be shorter, but you feel like it's not something you control at the moment, given your current staffing situation.
And then there's a general issue of staff stress. You might have a new graduate who's, tearful and upset because of a potential mistake that was very narrowly avoided, under a lot of pressure. They're feeling not well supported, especially with more difficult work. And it all takes time to sort it out. And if you're a senior manager, you can be chewing up long periods of time sorting out these sorts of things.
Absolutely. So we thought what we might do is ask you about what do you think is happening out there. So these are some examples we've given of common things that cause businesses pain. But what is happening out there? What are the business pain points? So we thought we'd, if you can put some in the chat if you want, or in the Q&A. If you want to put them anonymously in the Q&A, that's fine. But let's have a think together about some of the pressures that people are under, and we're going to ask the Vet Council about it as well, and we're also going to do a poll to get you to get a feeling of the group. So
shall we do that poll now?
Yeah, okay, we can do that.
Yeah.
Okay, so
over to you. Okay, so the question that you're asked to respond to, and your answers will be anonymous, but you can tick as many of these 4 points as you like. But which of the following are moderately challenging for your clinic at the moment? So tick as many as apply. Number 1 is difficulty with adequate staff replacement for holidays. Number 2 is chronic staff conflict, resulting in a tense atmosphere. Number 3 is regular, which is more than once a month, complaints. And number 4 is generally high staff stress levels with more than once a month upsets. So how are we going? I think we're seeing these live. Is that right? Yep.
That's good. So we've got some people are saying none of the above are causing them pain. We've got that in the chat, so that's good to know. So you don't have to be having these issues in a clinic, so good if you don't. What about the poll? Have we got some results in there to see the sorts of issues that have been coming up? Ian, are you able to show us the responses? We've got a few people who've responded.
Yes, absolutely. You guys should be able to see it in the chat if you have a look over there. Otherwise, I can summarize.
Yeah, so some staff shortages seems to be quite a common thing coming through to us, and in the chat seems to be quite a common thing at the moment.
Yeah.
And have you got any, so you've got the results there in the chat. So what have we got? Staff, so a bit of everything really, isn't it? It's a bit across the board really.
Yeah. But
Staff
certainly
difficulty.
the staff issues.
Yeah, seems to be the top there, doesn't it?
Yeah.
Yep.
Okay. And have you got anything to add to that, Seaton or Ian, about what's happening in the profession at the moment that's causing difficulties, do you feel? Challenges?
Yeah, certainly. I think perhaps a little bit anecdotally, but I'd say that we're seeing more complaints being raised with us. We're certainly hearing more noise of clients complaining to disputes tribunal, for example. So we do think there's an uptick in the frequency of complaints coming through to us. The other thing, I've had a few conversations with staff who've been asked to cover more shifts, do more on the roster than they're expecting, and potentially even more than they thought they were contracted for. And so there seems to be that questions around do I have to do all these extra shifts that I'm being asked to do? So probably an indication of staffing shortages. To your point about holiday rosters, holiday leave, things like that, but maybe even just a general shortage. So those are a couple of things we're certainly seeing coming through to us. I don't know if you've got anything else, but those are probably a couple of key things from us.
Yeah. And so I think that this sort of issues with the workforce, common across the health professions in New Zealand at the moment, maybe not enough people or people under pressure, conflict in teams, worries about is this affecting the quality of care, which of course is a bit of a driver for change, for trying to improve things if we feel that the quality of care is going down. These sorts of things can be a very good, compelling reason to take action.
That's right.
Also in thinking about systems change in an organisation and also training individuals. What we do know from the evidence is that in terms of something like burnout, the changes that are really effective are mainly to do with organizational change or systems change. So about 80% is going to be that down to the business to actually make some change in the system or in the things that are happening in that workplace. About 20% of stuff individuals can manage by upskilling themselves in certain sort of ways and becoming more resilient and stuff. So in terms of your most effective way of having a wellbeing initiative that works, you really want to do both, upskilling individuals and having a look at some of the systems things that are happening.
And certainly looking at these pain points as a bit of a portal to sort of sell the reason for putting energy into wellbeing. So the big one that we will look at a little bit more is attrition, which addresses that first pain point of the staff rosters. So it's sort of a hook that you want to use to sell your rationale.
So we thought what we'd do is we'll have a look at some of the motivations for change. So this is really the carrots and the sticks, what might motivate people to change. And we also thought we might look a bit at how do you have conversations with people about this sort of stuff. So we're just going to go back to our PowerPoint. I know PowerPoints in an evening feels like a bit much, but here we are, here you all are. So we're moving on from this and we're going to just have a think about in general what motivates people. So it may depend on somebody's role or what they're responsible for. With all of us, we can be more or less motivated towards or away from something, depending on our values and what's meaningful to us. So this is partially why some people have real passion for something like well-being, and to somebody else, it may not be a priority. Interestingly, some of us are more task focused and other people are more relationship focused. So it can make quite a difficult discussion if one of you is very focused on keeping the atmosphere nice and everybody getting on, and somebody else is just interested in getting the tasks done. And sometimes we talk about a get it right versus a get it done mindset. And it's not that we're one or the other, but very often in a team where there is some sort of conflict or difference of opinion, it's some of this that's going on. People want to get it done properly, and other people just want to get it done. And so it can be quite useful to think about where the other people in your team are coming from, especially if you want to get them on board with something like a wellbeing initiative. And we're going to have a think in a minute about some specific carrots and sticks, but some of the common ones are, what are the drivers for a wellbeing initiative? And for some people, it's to do with mitigating risk. For other people, it's to do with not having cost effects of poor wellbeing, or the reputation of the practice. So it's not a one size fits all. So really, this isn't about manipulation. It's about thinking actually what motivates you and what motivates the people that you work with.
And the commonest mistake is that we assume that the other person is the same as me. And so if we're really relationship focused, we'll prioritize that, but it might be completely not working if the person is one of those task focused people.
Renske and I have been working together for 30 years, and we practice this between us, trying to work out. We're a bit more aware of it now.
That's right.
So we thought we'd have a look at some basic approaches to motivation. I mean, this is a very simple thing. This isn't an evidence-based slide, clearly, but the carrot or stick sort of approach to motivation. So with a carrot, we're thinking about, wanting more of these positive things, making it a positive culture, attracting staff and keeping them, and having staff who are satisfied and clients who are satisfied. So ideally, we want more of this. And of course, we're wanting less of these things: legal problems, poor quality care, dissatisfaction. So this is sort of a pretty obvious thing, but it's quite useful to think about it. Which of these are the most important to you, and which of these might be drivers for motivation in the practice? So let's have a think of some of the carrots, Ren.
So there are my nice heirloom carrots at the top there, still with a bit of dirt on them. But basically, the first thing I'm going to talk about is just the general experience of positive workplace culture. We know that less distress and better well-being are linked to these three things: a high sense of belonging. And that's really interesting because even if you've got a very high stress and high demanding environment, if you've got a team that works together and has a sense of belonging, there can be a lot more satisfaction in the team. A high degree of organisational trust, and we're going to look at that a little bit more detail in a minute. And this idea of candid and open communication, which is a really big topic, and all of us can probably improve in that. So it's a very ongoing learning curve, but basically thinking about being able to have those difficult conversations that take courage. That's between workers. It's, with the employees being able to talk to the senior management. And that's something that often doesn't happen. What do they say about that, Fiona?
Yeah, bad news never travels up. So that's a phrase. And sometimes managers will say, well, if only somebody told me about that, we could have done something about it. So
that's right.
Being able to, wherever you are in a hierarchy, to have or work towards a culture where people can actually say what they think is probably a very good starting step.
However, it is the hardest type of communication, isn't it? Because of that power imbalance. So we will talk a little bit about that. So, of course, if you've got a reputation for a positive workplace culture, it's more attractive to staff. People tend to stay, people tend to want to work there. And you'll all know about that because you probably know what the reputations of the various vet clinics are and which ones to avoid. But of course, a positive workplace culture is a really complex interplay of all these different things. If you've got one difficult person who's very domineering and bullying, for example, it can sort of create a bit of a poisonous environment, can't it? How well resourced is your clinic? What's the sort of political climate? Are there stressful events like COVID happening? So it's all these things interplay. And we need to sift out what are the things that we can do something about and what are the things that we have no control over.
Yeah, like with any wellbeing thing, it's thinking what might be in my control to change and what is, in Scotland, to say out with my control, but that's not a word people generally use here.
So the first thing that comes up when we think about positive workplace culture is that it can feel really disempowering if the toxicity in your workplace is coming from the top. And so you can feel like, I can't do anything about this. There's no point trying to improve my communication. How can I get to feel safe with my relationships when there is this sort of tense environment. However, we're each still responsible for ourselves, and it's important for us, whatever our role at work, to sort of unpack what is this difficulty that I'm experiencing. Is it that it's a systemic issue? And of course, it might be systemic as well as personal. But if it's, the thing that you can do something about is thinking about your tendency in difficult conversations, whether you tend to shut down and withdraw, maybe feel resentful and powerless, or whether you tend to get into arguments and get tangled up in confrontations.
And as humans, we often want to say it's all somebody else's fault. So with these sort of unpacking things and thinking about them, generally it's not something to do in the moment. It's often something you do afterwards. And I'm quite a visual person. I like a good Venn diagram. So if I was trying to look at a difficult interaction I'd had, I would draw a Venn diagram of me and the other person and what was going on for both of us. And then the systems factors around the outside, what was the situation where we were having this difficult conversation. Yeah. So that can be useful.
And one thing that Ian was talking to us about is that often as a manager, you may not even be aware that there's a problem. And when you finally hear about it and it's gone quite a long way down the track, you sort of wish that you'd heard about it earlier. And so it can be good to think, so is it that my staff are, reluctant to approach me for some reason? Is it me that I'm having difficulty with listening, with being available, that I'm too busy, that I'm too stressed to be able to connect with people? So thinking through those in a self-reflective way. So difficult conversations is a big topic, and as you may know, we run workshops on this topic. But one of the really, really key things that will help is to keep in mind this idea of creating safety in the conversation, because you do have some control over whether you up the ante or whether you help the other person feel, for example, understood, help them feel heard. You definitely don't want to make them feel threatened. So that's why privacy is important. That's saying criticize in private, praise in public.
We could all do with a lot more praising in public in our workplaces, I would say.
Going for small steps, especially in the beginning, so that you can get some traction, what we often call low-hanging fruit, to sort of really think what's going to make a difference that people start feeling quickly. Saving face is really just not exposing someone's weaknesses. So being discreet about how you have these conversations and letting, the senior person who maybe is not as on board as you are, letting them have some credibility and some mana in the process.
Now, this thing about you and me against the problem, that's not something you're saying. It's more of a mood that you're trying to create, that you remind yourself before you have any of these conversations.
And the way you do that is with this careful sort of together language, so that you're saying, what can we do about this? I hear what you're saying, with a good summary. And on the other hand, avoiding the word but. So, and then you give your point of view. So you're really trying to align your objectives. We both want what's best for.
Yeah. I mean, common goals are really handy here. If you know that there's a common goal, you can bring that into it. So, but really showing that you heard their side in a way that's not patronizing, especially if you don't agree with it. You have to really watch your tone and your non-verbal behavior while you're saying that. Okay, on to the next carrot.
The next carrot, psychological safety, which is actually a really nice concept and phrase, and it has Amy Edmondson has done some of the earliest work in this in the early 2000s, and it's the #1 predictor of team effectiveness, and we all want our teams to be effective. So what is it? It's the belief that you personally have that you won't be punished or humiliated for speaking up with your thoughts, ideas, questions, etc. So it's a shared expectation in a team that we won't be embarrassing each other, rejecting, punishing them for taking risks. So we want, this idea of open, candid communication. And it links to the concept of collective trust. And collective trust in a unit is this honest and cooperative behaviour which gives us a feeling of security and safety. And we all know, if we feel safe at work, then we're not in our sort of primitive downstairs brain part of our nervous system, which means we've got full access to our thinking mind. Whereas if we feel threatened, if we feel exposed, if we feel stressed or attacked, we will be in our downstairs brain, and then we can't think clearly. So it's about healthy relationships and creating this collaborative atmosphere where we can rely on each other. We were talking about presenting together, knowing that we've got each other's back, and how much support that feels like you have.
Absolutely. So
do you want to do one?
Yeah, no, I'm just thinking about, so with lots of positive things, but there's a lot of stuff in the literature at the moment about this idea of collective trust and how you can try and train yourself to recognize when positive things are happening, to acknowledge and appreciate things. And when we're tired and stressed, we get into quite a negative mindset because we're human. So it's this idea of fostering a culture of care. And it's like, well, how do I actually do that? And it can just be saying, thanks very much for that, or I really like the way you did this, little things. And some of this role modeling. We've had a lot about normalizing things can really help, as well as sort of, oh yes, of course, lots of us feel like this can make quite a big difference in tackling the stigma.
And just to say one thing about the more senior you are, the more power you have, and particularly in influencing the atmosphere at work. So, training yourself to be more focused on positive stuff and doing more compliments, etc., really builds this.
Positive leadership, of course.
So again, there's quite a bit of work done by Josh Baseman in the States on these 4 Ps, that as a leader, you can influence the psychological safety in the ways we've described by helping the people that you're working with to feel a sense of meaning and purpose in their work. The path is for expectations, that people know what they're supposed to be doing, and partnership with them so that they don't feel on their own.
Okay, so thinking about the sticks here, the Health and Safety at Work Act is a major one. So 2015 it came in, and it's good for all of us to know about. I'm sure many of you already do, but there is now a legal obligation for anybody who owns a business to make sure that it complies with these different health and safety legislation. And there's different components to it. So you need to be up to date with the health and safety matters, and you need to understand how the business works. But one of the things is you have to give appropriate resources to minimizing risk. And you also have to have processes for receiving information about risks, for dealing with information, and actually doing it in a timely way. So having a policy that sits in a drawer that nobody knows where it is and nobody actually uses isn't what you want to be doing. You want to actually be having something practical that is working. So you're better to have something simple that works. And now we are actually seeing some business leaders get into a bit of trouble with not having these things, not having a policy that has actually been actioned. So useful thing to think about. We've spoken about attrition, and of course we know the reasons that people often leave veterinary practice, and that this has an impact on people's health. But it's also useful to think about the costs of attrition. Often we always think immediately, yes, well, of course, it's very expensive to recruit and train other people, but there are a lot of indirect costs, lots of knowledge and relationships, things like this it's useful to think about. And it's like, well, how do you estimate this cost? So this was one of the US studies estimated that it was 1 to 2 billion annually. In New Zealand, the estimate that we've been given is that this is the replacement cost of a vet. So see how precious you are, all vets who are attending here tonight. You may or may not agree with this figure, but that's the figure that we have been hearing about. And burnt out staff at work is very common. So we know about the consequences. Often people are worried about error. Things like depression or burnout and stuff like this can be linked to more likelihood of making medical error, often because our concentration's a bit out, or we're just stuck in the daily grind and we're missing risks and opportunities. But there's also lots of other effects that happen, patient care, client satisfaction. And when we're burnt out, we're not very connected. We can be a bit irritable. We're not very present, and it's not really great for rapport. And it sort of seeps out into your co-workers. So it's not about blaming yourself or other people. Many of us get burnt out at various points in our lives. It's about recognizing it. and realizing that it is impacting on the business. And of course, Renska was talking about bullying earlier on, and we do know that there can be some workplaces where bullying is happening, and it's quite useful to think about. There's different definitions of bullying, but there's a sort of spectrum of unprofessional behavior, and it may not meet the such and such definition of bullying, but it's lots of little microaggressions and stuff like that going on that makes it a pretty unpleasant place to work. So thinking about that, there are lots of consequences of bullying and harassment and discrimination, and they can be financial. And I think one of the things that is useful to think about is that with the consequences, you can have staff being absent because work's just really unpleasant. So you get more absenteeism and turnover, but also you get the staff who are present who are just not feeling very good, and the morale's down and they're not as productive. So there are actually a lot of consequences from these different carrots and sticks. So if we just come out of that for a minute and have a think about it, as well as these sorts of carrots and sticks, you know, they're the drivers. They're the things that you might think, oh, maybe I'll mention this stick or this carrot or a couple of them with this particular person. What is it that drives them? And often we know the people that we work with, and we know what their drivers are because they make it pretty obvious, you know. So we can often sort of skillfully talk about those rather than talking about your own driver. But the other thing to think about is that we all have different personalities, and so as well as thinking about people's drivers, you need to think about how best to have that conversation with someone.
That's right.
So, you know, often if you try to bring up something about well-being and you get a negative reaction, it can be a whole lot of different sort of reactions. So it could be like aggressive. Yeah, well, I'll tell you what's going to improve my well-being. How about you sort out the on-call roster? Right. So you can have an aggressive reaction.
Or you could have a defensive and someone who has issues around it needing to be private. So they might say, what's it got to do with you? My well-being is none of your business.
Yeah, that can be quite a common one, can't it? Sometimes people are just really cynical and eye-rolling, and they're like, oh, yeah, well, I prefer actual science and facts myself. And so they have quite a cynical, you know, approach to it.
Or they could be very dismissive and focused on practicalities, saying, yeah, that's all very well, but it's just not a priority at the moment.
So thinking about how do you respond to some of these things, and it's not a one-size-fits-all thing. So it's always useful to think about how you might respond to some of these. So when I was putting a well-being program into medical school, for instance, I had all the evidence for it at my fingertips about, you know, depression being linked to medical error and stuff like this. And so when I had somebody who was saying, I prefer science and stuff myself, I could be saying, oh, absolutely. And there is a lot of science at the moment about this. So you can sort of have something that will appeal to that person. Different approaches for different people.
I think we sort of think a lot about anticipating these conversations, and so you might be able to forecast what sort of a manager you have, or you might even be able to put them into one of these 4 categories, and so you can actually plan what you're going to say. But one of the important principles is to try to get alongside them and not to get into an argument where because you feel like you're right and they're wrong. But first of all, to find a way to sort of say yes in a way. So if the person who says it's none of your business, you might say, you're right, you know, well-being is a really private thing. And, you know, I'd really like to help us individually find ways to feel more, you know, confident, relaxed, comfortable at work, and to help our team feel a bit more trusting of each other and optimistic and
absolutely, yeah. And sometimes if you're in a meeting where people have got different opinions, and I'm sure many of you have been in meetings where people have different opinions, the key to this is just trying to get people heard. If you're the person running that meeting in a non-judgmental way, so you're sort of getting everybody to say, all right, so John, sounds like you're thinking like this, blah, 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 and Sarah, from your point of view, blah, blah, and Kahu, you know, you've been saying blah, 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 and my thoughts are this, you know, and then given that this is the situation, let's think about what our options are here. So and that sort of thing where you state people's point of view and then you look at it together, that's turning it from me against you to us against the problem, and that can be really helpful. So we thought we'd just go back and do a couple more slides here. If you just let me do this. Right. Excuse me, clicking in and out. So in summarizing what we've been saying so far is it can be useful to think first. What might be driving somebody? Is it cost? Is it health? Is it attrition? Are there particular carrots or sticks that you think it might be really worthwhile mentioning? And what do you guess might be their personality or their initial reaction? And we're not frozen into our personalities. You know, them on a good day and them on a bad day might respond differently. But you need to be flexible in your response. And the key to, as Rem was saying, is not it turning into an argument. Remember what your goal is. Your goal is to get some sort of well-being initiative started, even if it's a small thing. So arguing is going to be against that goal. And we put some different reactions there. And then you want to try and actually use your communication skillfully. And these are real skills. So you have to think about, what's my body language? Do I need to be assertive when I'm saying this? Or is that not going to work with this person? Are there boundaries I'm going to have to put in place here? And this is a lot of what we were saying, is showing that you've heard their point of view. So this is this idea of saying, all right, so it sounds like from your point of view, blah, blah, blah. Even if you don't agree with it, in fact, especially if you don't agree with it. And when you're saying that, you have to be very careful of your tone of voice and your body language. Otherwise, you're going to be saying, well, I know you think, and you're going to be escalating it. So you're just stating it in a neutral way. Now, this is something from the motivational interviewing literature about behavior change, because what we're talking about here really is about behavior change on some level, and how do you motivate people to change their behavior. And one of the things from that literature is this idea of ambivalence. So if you get somebody who in their conversation with you shows some sort of ambivalence, well, I suppose, that's your place to get in. You know, you say, oh, so like, it sounds like, Susan, that on one hand you think this, on the other hand you think there could be some value to this, and that's where you want to get in. If somebody's just saying, no, absolutely not, and they're resistant, what you want to do there is show you heard their resistance and just try and keep the relationship.
So you might have to back off, but I guess we want to be strategic and think about finding a way to maybe represent it in a way that might be more palatable next time.
Absolutely. So let's have a think about some strategies.
Some strategies to address the systemic issues. And we've collected these partly from our experience, but also we have been working with vets a little bit over the last 2 or 3 years. And certainly the idea of people who are already believers, people who are enthusiastic about well-being, become your allies, and you can have a small group of enthusiastic people who can make things happen, the well-being champions.
And if you don't like the word well-being, use something else. Like, I don't like fluffy terms. They really annoy me. Ren finds it quite amusing. She's known me for years, but call it something else. You know, you don't have to go with these terms, but just remember the evidence of helping to change the culture at work and sliding it into a more positive space, and the consequences.
Pick your battles, and we really want to encourage you to start with things that are easier, start with things that we have a high yield. So the common things are, social gatherings, or, a positive gratitude board, or something that is easy to do. Polite, patient, persistent is just about trying to stay in your best self, where you can be calm and sort of smart about it. If it doesn't work one way, try another way. Talk about it, plan.
And that means that you might need to pick, when you have these conversations, from your point of view. If you're feeling really stressed and everything, and you decided you were going to talk about it on Tuesday, maybe Tuesday's not the best time to have that conversation if you're not feeling calm enough and able to skillfully respond rather than having a reaction when somebody's talking to you.
Keep in mind the big picture, it's long-term planning. And we definitely don't want to get into just complaining about what's wrong. So anticipate the need for a solution, and perhaps have one ready so that you can show that you are not just dumping all the problems in their lap.
And it could just be a solution for a small thing. So we often see people avoiding starting wellbeing initiatives because it feels too big. And there's no need to do that. You can just take a small thing. Let's think about improving the situation behind the desk that's causing a problem, or just take a small thing. Don't start with the biggest thing in the practice, because it often that makes it all feel too hard.
Engaging with low-hanging fruit, we've talked about that. And Lottie's provided us with this really great list of resource agencies that a lot of these are New Zealand resources that vets have been using. The Resilience at Work program run by Catherine Jackson has got some really practical, helpful things to do with workplace wellbeing. You can do some of these free personal psychological safety surveys. You can do that as a team to see it's a bit like taking your temperature as a team. The Good Yarn program, you've probably heard of that. It's been talked about in veterinary contexts. It's a really, really good, thorough, evidence-based resource where you can look at different mental health issues. The mental wellbeing by design process, which is something that can be adapted for vets.
So you sort of explore some of these things and think what's relevant for your clinic. I really like this site. I don't know if you've come across Sarah the vet, but she keeps a blog and she writes about lots of well-being issues. And in fact, a lot of what she writes about is sort of comes across as quite informal, but it's actually very linked to the evidence at the moment. So we were just saying that there's a lot of stuff at the moment about organizational trust, and she's writing about that now, and she's got these different quotes there about how when trust is present, you don't really notice, but when it's absent, everybody notices it. And she's got some very readable stuff on that site. So if you want to do a bit of browsing that doesn't feel too heavy, it's a great one to go to.
So
what about Ian and Seaton? Have you got other well-being things that you want to mention for the veterinary teams and vets out there?
Well, I'm never short of a word, so I'll start. How's that? Look, I mean, this is a great resource, guys, and I've enjoyed this conversation. I wonder if there are any employers out there certainly my experience has been it can be quite overwhelming when you're getting confronted with a question about your leadership, and whilst that's challenging, it's a great opportunity. But what I would say in my experience as well is getting some support, some advice, a consultant or something to help is incredibly useful. You don't need to do it on your own. It can be tough being a boss. Nobody sees that, but getting someone to help you, a consultant to come in and help, is a great opportunity. The other thing while I've got the mic, I thought was a useful thing, maybe weaving in some questions. If you're an employee and you've got a problem environment, maybe weave questions into trying to navigate with your employer or your boss. Well, have you noticed an increase in number of client complaints? I've had a couple this week. Or have you noticed that Sarah's been away a lot? I wonder what's going on, and try and maybe engage in a conversation of helping them find the problem with the conversation. I don't know. That's two things that I sort of thought of sitting here, which might be useful, but very, very useful, guys. Appreciate it. Sorry,
it's a great idea though, Seaton, isn't it? Getting them to identify the problems, because what you're doing there is you're sort of getting buy-in, aren't you? You're getting them to identify, and once somebody's identified a problem in their own voice, it sort of makes them more part of trying to help sort it out, or acknowledging it is the start, really, isn't it?
Yeah, it becomes a we then, doesn't it? It's not I'm telling you. It's hey, we've identified this issue, and I think that sometimes it takes a boss a little while to catch on, and that's maybe a subtle way to have a couple of conversations which are a little less confronting as well, which could be good. Ian, you're smiling. Right.
And I know that sometimes in a hierarchy, people will work in very different sort of clinics. So some are quite hierarchical and others are less so. And we all have different workplace settings. But in a very hierarchical place, sometimes people decide if they're lower down in the hierarchy to do it as a group with 2 or 3 people to approach with an idea. They just feel more comfortable to do it that way. And that's also something to think about.
Agree completely. Yep. Yeah. Team up on them. No, I didn't mean that. But a couple of conversations, people be able to navigate the conversation a little more subtly would be useful too. Especially if you're an employee and feel nervous, having a buddy.
That's right. Yeah. What about you, Ian? Did you have anything that got a bit stirred up with that you want to talk about?
Oh, just learning, learning about Seaton's tricks, what he uses on the office is good. I did notice somebody popped in the chat a question about, how many, there's a great idea how many practice principles and managers are in the webinar tonight. I will say a few, just looking at the list of names at my end, but also I hope it's become clear now, a lot of what we're trying to do here is build tools for people who, and maybe we should be clear about this, people who aren't practice managers or principals, who don't have the power just to make policy and make changes, but I guess what we're trying to do is put forward some tools for managing upwards, if you will, for making change when you're not necessarily the person who's responsible for the change. I hope that's become clear now.
Yeah, because it can be very frustrating to be in that situation where you've got some ideas, but you don't feel able to air them. And that's what psychological safety is about, isn't it? That you don't feel able to put your view forward safely without it having some repercussion. So we're wondering with the people out there, if you're got wellbeing initiatives underway, and we do know from some of the work we've done around the country with different veterinary practices that there are some really great things happening out there. And there's probably some people here who are enthusiastic about wellbeing. You might want to put them in the chat so that others can see the sorts of things that are happening, some of the initiatives that are happening.
We particularly like this concept that vets have taught us actually about low-hanging fruit, which is really about things that you've maybe done in your clinic that have had a positive impact on the workplace culture. I think one of the things I'm remembering is this whole idea of training yourself to become more positive by making it something that we do together in a team. So you might have a notice board with gratitude phrases on it, or thanking people for things more often than you normally would. And we're wired to do it the opposite, to be more critical than positive. But this is something that we know from the research that you can train yourself to do.
Absolutely. So have we got any things in the chat that people are sharing or about any well-being things? Lots of things here.
I think one of the things that comes up quite a lot that people get a lot of mileage out of is doing clinic social activities regularly and making it, sort of normalizing it, so that people might have turns, or there might be a social committee, and it doesn't have to be expensive. It might just be, a family picnic with people's families, with the clinic. That the social relationships is just such a foundation really for collective trust and psychological safety.
Some great ideas in the chat here. So about pick one thing every few months. I really like that. So anybody can put forward a thing that they'd change. And people call these things like great ideas, or there's different names for these sorts of initiatives. And you can make that anonymous. You don't need to say whose thing it was, but you just agree that you're going to take one of these things to change. It can be quite liberating to read the ideas that people have. And of course, it's the people in the workplace who know about what the thing is that needs to change. So you can't say, oh, every clinic should do this, because that's just not going to work. It's got to be relevant for that workplace and the people in it.
That's right.
The other thing to remember about workplaces is, of course, it's a team, and team dynamics change. And every time there's a new team member, the whole team dynamic changes again. So, and in places with a lot of staff coming in and out, that really affects the team. So instead of thinking, why is everything going wrong? It's actually just because you've got a team that's trying to bed in, and then it doesn't get the chance to bed in, and it's another team bedding in. So it's not blaming a person for that when that happens.
There's a good question here about social activities that we all agree that they're good, but not everybody wants to join in, and there might be some introverted people or shy people or people who are reluctant to join in. How would you get them involved? I guess I'd probably ask them what they would like to do, and normalize it, and it might be quite a different activity.
Yeah, people sometimes want to do something together, like going on a walk or something, going on a tramp, not a huge tramp, but, let's go on a walk where you're not having to all sit around a table and stare at each other. So some of those, and sometimes that's why people do activities, isn't it? Like bowling or something like that. Other people hate that sort of thing. I remember winning a prize for the most gutter balls at a work bowling thing I was forced to go to. But when you're actually doing something rather than having to sit and talk can be less confronting for people. Maybe you could get a projector and screen a film in the waiting room and have some popcorn. But I'm just thinking of random things here. But something that doesn't involve that sort of face-to-face social conversation, because many of us really don't feel comfortable with that sort of thing.
Yeah. So there's a good comment here about focusing on the sort of systemic issues. I think that's what we're talking about here: stress and abuse in a private practice, which sounds like sort of toxic relationships, and that mustn't go people tend to ignore it as long as they can, and then it has all the negative trickle-down effects. And then it's really pointless trying to teach people to do mindfulness and more personal resilience stuff when there's actually a bully who's being tolerated at work.
And someone talking about the public there, we're not the emotional punch bag of the public. And I think this is happening for a lot of front-facing health professionals at the moment. So we are putting up with a lot of abuse and it's not acceptable. And that sort of, you should be more resilient and why don't you learn to manage it, isn't helpful. And that's what I was talking about earlier, that it's, 20% of stuff you can change. You can manage angry interactions, you can do stress management training. But if it's the system where the system's set up that you're behind a desk or people are shouting at you all day, it's about the system, isn't it? What can you change as a clinic? Can you have signs up? Can you have an agreement that if somebody behaves in a certain way, you set up a barrier, or you can ask them to leave, or you can say, use one of the techniques we were talking about with boundaries. Obviously, you're really furious that this has happened and then this has happened and this, and you really want this and this. And on the other hand, if you keep shouting in the waiting room, I'm going to have to ask you to leave.
Yeah.
So it's sometimes deciding on a policy, a practice policy, and acting it out together, saying, right, enough's enough. This is our bottom line.
In fact, it's making me think of the Vet Council videos that you guys have put up on your YouTube channel. We've got 3 of them, haven't we? There's an angry interaction with me being angry about a sort of being kept waiting.
Yeah.
And then there's a sort of boundaries and assertiveness interaction with a really difficult client who's very, very demanding and is using up lots of clinic resources and how to contain them. And I think the other one is a burnout one.
Yeah, we've got, there are various ones and you can have a look at them. I mean, it's interesting. A lot of people are talking about the public here, Ian and Seaton. So do you think, is there any, way of educating the public to, respect and value the veterinary profession more? Now, there's a big question for you on a Thursday night.
Look, I'll say, I think you guys touched on it already, but it's something we've seen, and I think other professions have seen in New Zealand, certainly other veterinary professionals reporting overseas. It's just a general rise in conflict from the public, from clients, incivility in society. Some say things like, phrases like that, but a lot more lack of social cohesion, a lot more conflict across the board, and that does. We hear time and again that's coming out in veterinary practice. I know it's not new, but certainly the practices I've spoken to recently to say it's gotten a lot worse in the last few years. I will say, I think there are things we can do at a higher picture level in terms of educating the public, and it's certainly something on the Vet Council's radar, but our reach is always going to be very different to practices who can educate their own clients. And I think there are some consequences as a practice that you can implement that are helpful. I know of a practice that their staff have a quota of you can fire X number of clients over in a given quarter or year, and that's perhaps a little bit of a glib way of looking at it. But what Fiona Renske was saying before about enforcing boundaries. There are enough clients for most practices at the moment that you don't need to have all of them. You can say no to clients and you can set expectations, and you should. And I think it's a really powerful tool for employers to be able to say, look, I value you more than I value that one client. You're more important to me as an employee, and I fully support you in terms of setting boundaries and saying no to dealing with clients that are demonstrating unacceptable behaviour. I know that doesn't fix it. I know it doesn't fully fix the problem, but I do think there's a lot to be said and a lot can be done at the local level that really does make a huge difference for staff that are facing that. It says the one non-vet in the room. So, Seaton, you might have something more to say there.
No. I agree completely. We used to have that sort of principle in place in our practice, which was you can fire a client a year. Funnily enough, I think staff took that very responsibly and didn't go crazy with it, and often came to me first to go, look, we've decided we want to get rid of Seaton. Are you okay with that? But it was a good process, because I think it does help vindicate your, you've got some autonomy over some control over what's happening, and that's really good. And it doesn't have to be rude. I mean, there are nice ways to tell someone that your values on animal care don't align, and it's time that they found someone else to meet their expectations.
And I think expectations are a big part of it, aren't they, Seaton? It's often a total mismatch in expectations. People have expectations from the old days or whatever, and it's just completely unrealistic. So showing you their expectations and then saying, and on the other hand, this is what we're able to do and this is what we're not able to do can be quite a helpful thing.
And it may be that we're not quite the right practice for you and your animal.
Exactly.
I mean, and there's quite a lot of debate here in the chat about feeling quite a lot of sense of anger at some of the public, feeling like, vets are trained to take it and they can just abuse them and vets should have to put up with it. And certainly, doctors get a lot of this. Pharmacists are getting so much of this at the moment because they're just standing there and they're a health professional and people just come and, be abusive. And, there's a point at which you don't have to stand, obviously if you're scared and there's a point where you run away if it's a physical thing. But if somebody's abusing you, you can sort of say, obviously you're furious because of this, and on the other hand, this isn't acceptable. You standing here shouting at me, I'm asking you to leave. And if they keep going on, I'm going to call security or have to call the police if I'm asking you to leave. So you just have to have a boundary with it, I think. And interesting, somebody's saying, and that with some practices are more afraid of a bad Google review, and that's more of a priority than their staff's well-being. So they're desperately trying to please the clients, or they don't want to annoy the clients by saying that their behavior is not acceptable. And I think if that's the culture that's happening in a practice, that would be a really good group discussion to have all together, to be saying, actually, because that's about feeling undervalued and under-prioritized. And when you're feeling undervalued and under-prioritized, that's one of the things that feeds into burnout. There's various risks of burnout, lack of control, lack of autonomy, not being able to use your skills, being in an area of conflict. But feeling undervalued is one of them. So I would, get together, say, actually, a group of us are feeling undervalued and it's not being good for our well-being and it's making us not like work here, not feeling very productive when we're here, we're not wanting to be here. What can we do about it? And, talking as a practice, what are you going to do about that? What if someone does give you a bad Google review? Are you going to let them behave however they want if they threaten you with a bad Google review? I can remember somebody coming in when I was in general practice with a list of drugs they wanted and saying, if you don't give me these drugs, I'm going to complain about you to medical council with this whole list of stuff, which I knew would be a 2-year process. But, I decided, well, you just can't give in to that, because where does that leave you? So you just have to say, well, if that's what you want to do, that's what you can do. And I'm not giving you these drugs. So, if people have different opinions about that in a practice, that's where it can be difficult. Yeah.
So we're coming up to time, and we may not have answered everyone's query. Is there anything we've left out, Ian and Seaton?
I've started a very good conversation, I think.
Agreed.
And maybe just find 1 or 2 things to take away. We know that this isn't the sort of thing obviously we're going to sort out in a webinar, but it's important for the profession to be having this conversation, thinking about what your practice is, thinking, are there any carrots or sticks or small things that you could do? Are there people as a group that you could talk about it? Often practices just aren't talking about it at all, even though everybody knows it's going on.
And perhaps exploring some of the resources on that, one of those last slides, because it sort of tends to, when I've looked at them, it sort of wakes you up a bit. It makes you realize that, this isn't something I'm having to invent myself. There are really good scaffolding strategies around that can support you to make the next steps.
Yeah, lots of things in the chat, and about how we can be empathic, but not, we're not responsible for someone's actions and someone's emotions. And, you're not there being therapist. Well, Ren is there being a therapist, but you're not there being therapist. So, yeah, absolutely. So that's in their paddock, as we would say. that, and it's what you're prepared to put up with or not. What is your bottom line as a clinic?
Yeah. And keeping in mind, what are the things I can control, and focusing your action strategies on that.
So we're going to leave it there and say ka kite, and have a good peaceful rest of your evening, and well done for working, my goodness, up till 8 o'clock when you've been working all day.
Yeah.
And thank you very much to the Vet Council for inviting us to be part of this conversation.
Yeah. Great. So good night.
Good night.
Akite. Thank you,
Right.
guys.
Huge thanks to everybody. We will circulate a evaluation poll. Please do consider filling it out for us. It helps us make these better in the future. Again, thanks so much, Fiona Reska. I really value your time and your expertise tonight. And again, thank you to everybody for coming. We'll talk to you soon.